Dear colleagues, we continue working the Ukraine Crisis Media Center. The topic of the next press conference is has hospitals to open the doors to the intensive care units. What are the next steps? Our speakers are Viktor Shafranskyi, Acting Minister of Health of Ukraine, Anastasiya Leuhina, co-author of the Ministry's order to provide access to the hospital's intensive care units, Anna Karashivska, co-founder of the public initiative Being Close, Katerina Bulavina from UNICEF. Dear guests, you are welcome on stage. Good morning, dear colleagues. I'm very glad to be here with my colleagues. Together, we have done a very good thing. The order number 592 have been developed and approved on the access of relatives of patients in intensive care units. So now access to intensive care units is free, they can visit them. So when patients are visited, the dynamics of improvement of their condition is quite better. And the family also feels better when they can care about their patients. I can share my own experience when I was about 10 years old and I was operated and I was in the intensive care unit. I felt physically and emotionally sick, and when my mother was allowed to visit me, I felt much better. So now I take the process of elucidation of this order under my personal control, and we will have the selected meeting where I will provide directives, clear directives to the regional departments of the Ministry of Health, so that the stay in resuscitation rooms be improved. I would like to thank civil society for their help in our joint work. There were several working meetings where civil society representatives also provided their opinions and attitudes and helped to resolve this important social problem. Anastasiya Leuhina, for me this day is very special. When I was on my way here, I thought about 3 mothers who died in the resuscitation rooms without relatives close to them. And now I would like to give several facts how it became possible open access to critical care units. It was our joint work. In fact, we think that this step is very progressive and our hospitals will become more friendly for patients and their families, and this order will make actions of the staff in critical care units more transparent, and relatives will help patients, will help the staff to care about the patients, and also this would discipline the staff, because previously they had been out of any control and no watchdogs were allowed to enter resuscitation rooms when our relatives get in intensive care units. They were out of our helps. Now I would like to say that it was a co-creative process indeed of NGOs, individual patients and parents, and the Ministry of Health. The order was adopted very quickly. It was just 2 weeks during which it was approved, and the wording of this order is the simplest out of all the legal and regulatory acts of Ukraine. And I would like to talk about people who made this possible. There were more than 50 civil initiatives: Ternopil, Ivano-Frankivsk, Kramatorsk, Odessa, very many cities and towns, and 10 or 11 members of parliament joined us in our efforts. There were about 10,000 man hours we spent during 2 weeks. So we put enormous efforts within 2 weeks. Being a mother, I told in the parliament that my child died in the closed resuscitation room. I was surprised because I was heard by a bureaucrat in the Ministry of Health. There were thousands of messages and letters and telephone calls. The campaign has been 10 months long, but in fact it was 10 years of struggle where efforts were put by many people and who struggled for the open access. Who were they? Who created this initiative? About 1/3 of them, they were victims of the closed resuscitation rooms. About half of them were patients, former patients, or just citizens, active citizens who joined our initiatives. And 16% mass media sources supported us, and 4% of medical staff. They also supported us in a very professional and cordial way. I would like to thank them. And about gender distribution of those who were used in this campaign, 95% of active participants in the campaign were women. Only 5% were men. They could be named by surname. There were several MPs and doctors. And to summarize, I would like to say to those whose relatives may get into resuscitation rooms, this order would not be possible if we were not struggle. So mothers, parents, and relatives submitted complaints, so you should submit complaints. We addressed Ombudsman office because and the Ombudsman who is in charge of places where people are not in a free regime of visits. The Ombudsman office responded to us that they hadn't any complaint about such closed regime. So submit your complaints now, otherwise tomorrow it could be too late. Anna Karashivska. I am a representative of the public initiative Being Close. This initiative was founded by the parents who care about such a problem as resuscitation rooms, closed doors. We try to help in finding consensus between the staff and the parents, so that the staff explain to parents what is happening with their children, what equipment, what treatment is provided in the resuscitation room to their children. To this end, we developed some materials. We used best practices from European countries. We saw how the hospitals manage this process of resuscitation in hospitals. We are very thankful to Children's Hospital number 7 who helped us to prepare these materials. I would like to demonstrate them to you. We expect they would be useful, and both parents and staff would use them in order to improve the process of communication with relatives of patients. You can see the brochure for babies resuscitation rooms units. This is very important that we have 500 hospitals which have status of friendly for parents, but there is no access of mothers to resuscitation rooms. Also, Ukraine support UNICEF convention who are breastfed. That is why we launched initiative to help those mothers to continue breastfeeding, because this is very important for development and health of a baby. This is the poster for rooms where mothers can collect the milk so that it is then transferred in bottles to children. The information is provided how to adapt requirements to specifics of various hospitals. For example, some burn care center. I would like also to provide information that we some time ago held concerts in resuscitation units. It would be good to hold such events in other cities, because resuscitation rooms, they are not jails, they are not places of containment of people. Even music can sound there. Doors to resuscitation rooms should be open.
Thank you, Anna. And now I give the floor to Iryna Litovchenko. Good afternoon, dear colleagues. So we joined the work with our colleagues, and you know that several patients who were supported by Tabletochky organization, they died. So these people who are in the resuscitation room, they need artificial ventilation of lungs and other things. And at the last moment, their parents, they were not able to join them in the resuscitation room. And now this order was adopted, and together with the journalists, we visited several hospitals of Kiev, and we had the opportunity to speak with parents. We asked them whether they know about this order. They said that they know about the law and they know that they can come anytime, starting from 11 till 6 in the evening. So this part should go. Everyone should understand that they can visit anytime, and we as organizations and the ministry and other people who worked, we did everything possible. We provided people with an instrument, and now it depends on people how they will use it, whether they will fight for their rights and whether they will do everything in order to achieve results. So important moment is that this is connected not only with children, it is also about adults. I have a story that in the emergency room, my great-grandmother was there and she needed care as a small child, and it's very important that all people be near their loved ones, and we hope that the ministry will carry out work with the regional departments of health, or chief doctors of hospitals, and we will prepare information materials for doctors and for relatives, and we hope that in some time we will see real results, that relatives can come anytime to emergency rooms of our country. Elyzaveta Shunko is given the floor. Good afternoon, everyone. I would like to start with the fact that I am a neonatologist doctor, and we carry out activities connected with the children who are newly born, those who are in intensive care, who needs their parents. And for more than 20 years, the Ministry of Health and our hospitals, we now provide the women with opportunities to stay together with their babies at hospitals, and it was rather difficult. We explained why healthy child should be separate to their mother. The child should be with their mother. It should get milk from the mother, and we made first steps, and medical community and the public supported this, that the woman should be with her baby. And the next step we made is connected with the emergency rooms for newly born children. So if the mother feels well, the mother stays with the child, and when the child was prematurely born, the mother, any time during the day, a mother should be with her child. And of course, I am a doctor, and I want to say that doctors support open doors of intensive therapy, because we communicate with parents, and parents can see their child. A child gets all necessary therapy. And in emergency departments, they not only medicine treats children, but the presence of mother, of relatives, or the presence of father. Children feel this presence and their condition becomes better. And if we are speaking about breastfeeding, if we are speaking about the year of the first year, mother should be close to them every day, because in such a way health and life of child is supported, and we open the doors of intensive therapy rooms, and our next task is to inform the public, relatives and medical workers that we should understand each other better. It is needed both for the system of healthcare and for parents and relatives and patients. So, Ekaterina Bulavina, so the fund deals with the issues of quality service to mothers and children, and the support of relatives is needed. They should be able to go to these rooms and see their relatives, and in this way the quality of services provided will improve. So this order is a victory, but this is a start of this huge battle, because before this order there was no legal ban on this. But this order is the first step. I would say it's like military actions, because there are many people who are still against. And for me, it shows that civil initiative can be really successful. Civil initiative can enter into partnership with executive power, I mean the Ministry of Health, and be effective and successful. And also there are examples when such things were done before, and it was surprising for people. And the bright example is delivery rooms. So when we know that fathers waited outside, they write something on the ground, but now they provide access to these hospitals to anyone. So many medical workers were against this access. We try to find funds to finance training and to create communication strategy, because this is important. I mean, we as UNICEF believe that this is important. So I am a children's doctor, and I would like to draw your attention that this order concerns children and adults. So we should fight not only for the rights of children, but also for adults. And the adults are the initiatives concerning adults are lacking. Also, we are grateful to First Channel. They provided us with prime time, and also to Hromadske Radio. They also provided a platform for discussing such an important issue. So we had the program, and I was an anchor of this program, and for a year we conduct interviews on different medical topics, and we received comments. These were personal stories, and the majority was from the doctors whose relatives and children died without their presence, and they couldn't be with them at the last moment, and this was really sad to read. That's why I congratulate everyone with such a good start, and we believe that this is only a start. Thank you, dear colleagues. Now we start Q&A session. So please introduce Maria Makushenko, 1+1. Yes. So about the funds for the hospitals, because even after this order, we are not ready financially for this, because we do not have chairs, we do not have curtains, don't have facilities, 6 years in one room, and we hear about this a lot. So if a patient is in intensive care and a relative would like to visit, we need a mask, we need I always ask that they close me appropriately, and we should adhere to sanitary regime. So people should be provided with hospital footies, they should be properly closed. So things you are speaking about now, maybe this is not the problem, because in any emergency room there are chairs, there is furniture, so people can sit, and things you are speaking about, this is what my colleague said. It's a process that is only at the beginning. So we should use administrative resource, and then these issues will be lifted. So when about joint stay and delivery facilities, the situation was the same. There was some resistance, and it was really high. And there were such arguments that you mentioned, and there were arguments that looked as obstacles that cannot be overcome, and we should. And people just didn't want to provide access, and this law provides us with opportunity to improve the situation and to create new, better conditions for children and their relatives. Oksana Miknitsky, UCMC. I was speaking with several people whose relatives are in the intensive care facilities. Technical moment they face, maybe they know about it. There is order and there is a regime of access, and also they say that they know about the order, but they say that the relatives should visit until 8 p.m. So what people should say to get the access anytime? And you said about administrative lever, and what? So if a chief doctor do not implement this order, what is the responsibility and what are the terms? I don't want to focus on administrative things that lead to disciplinary actions. Believe me, in some time this order naturally will be used, and I repeat, if they say that they do not have some equipment for this access, this is not serious. These are subjective factors that do not relate. If in some institution there is some limitation in time, so no one prevents the doctor, the chief doctor, to introduce the changes in the document. And you know that the order of the ministry is the main document, and all other documents should be provided properly in accordance with this order. So if the decree of the president is signed, so this is the major document for the ministry, and we present the documents that adhere to the decree of the president. So this is a clear mechanism, and the things you say, they are maybe the reflection of the fact that everything new is very hard to introduce in life. Thank you. Do you have other questions? Maybe question to Anastasiya. Maybe you provided the statistics. What is the number of people who addressed before the order? So how many people complained, maybe anonymously? Do you have such statistics? We don't have such statistics. The only thing I can say, people who actively supported us, there are lots of people like this, and people don't like this. They are not comfortable with this. They suffer from these closed doors, but they do not complain formally. And if you do not complain to these bodies, so they do not see this as a problem. So people say, 2 weeks ago, father of my colleague died, and she didn't have access to him. So we heard about the sad stories, but the scale of the problem is much bigger than the stories we get from different people. So, Larisa Slyunchenko fought for this for 8 years, and she had active dialogue with the ministry in Akhmadit, and there are some complaints, but people usually do not complain, and this is one of the main problems of the situation, because if you do not complain, there is no problem. Thank you, colleagues. Thank you very much. Until the next time, goodbye. Dear colleagues, the next press briefing is at 11 sharp.
Але це ж державна програма.
Нормативне регулювання є. Просто